Assalamu alaikum, my dear friends. I hope all of you will be in the good state of health. Many of my friends send me email and text messages about Royal Australian College of Physician route. So, Royal Australian College of Physician assists overseas trained physicians, and based on the assessment, you are eligible to work in Australia. So, Alhamdulillah, I have been assessed by a Royal Australian College of Physicians, and I'm eligible to work as a consultant in Australia based on my qualification and experience. So, I cleared my FCPS medicine exam in 2015. Then, I was working as a consultant in my hometown for 6 years, both in public and private setup, till to 2021 July, and then I moved to Australia. Then I moved to Ireland, and I'm working as a registrar for the last 3 years. And Alhamdulillah, recently I have started to work as a consultant physician here. So I applied for assessment. For the assessment you need MC portfolio. So you will need to create your MC portfolio, um, and then you can verify your MBBS degree and your fellowship degree and your experience through Epic account, and then you can send these documents to MC portfolio. And then after that, you will contact overseas trained physicians coordinator, uh, and then you can there is a form which is almost 25 to 30 pages. That form, you need to fill that form from your internship or house job till the current employment, your whole qualification and experience. And I will advise you how to fill that form, because that form is very important for your assessment. If you fill that form properly, your assessment will be hopefully very good. So there are three kind of outcome based on the assessment by Royal Australian College of Physicians. So the first assessment, if your training is equivalent to Australian trained physicians, then you will get the assessment like a substantially comparable. If there is some gap and lacking in your training as compared to our Australian trained physicians, then you will get partially comparable. And if your training is not up to the mark, then it will be non-comparable. So Alhamdulillah, I got substantially comparable. Then I was offered to work as a consultant for 1 year at level 4 supervision, and then I can apply for fellowship of and permanent registration with the right Australian College of Physician. And this 1 year, there will be work-based assessment, and finally I can get the fellowship degree, and then I will be permanent registered with Royal Australian College of Physician, and then I can work in the whole Australia as a consultant. So this was my assessment. So those people and those friends who have completed their fellowship and they have some European experience, or even if they don't have any European experience, if they have some consultant experience, even if they don't have consultant experience, at least they will get partially comparable outcome. Then I know personally one or two of my friends. One is Ijaz, one is the other Khan, that belong to KPK, and they have been assessed as partially comparable, and they got advanced training, fellow training in Australia. One other Khan got in Melbourne, and the other, my fellow Ijaz, got probably he got in Melbourne. So You can assess yourself with Royal Australian College of Physicians. So I was talking about the MC portfolio, and then you will submit a form. By completing that form, that form include your what was your responsibilities and internship, or when you were doing your house job. In Pakistan we call it house job. So you will what is the outpatient responsibility, inpatient responsibility. So like admitting a patient, family meeting, writing the medication and the chart, cardiacs, all these things, and every work will be under supervision. Like we have done all those, almost our house job is almost comparable to Australian train entrance. So but you have to write it in a proper way. Like you need to write down your education aspect, your clinical responsibilities, and family meetings and MDTs and all those things. So then you need to study the fellowship curriculum of Australian trained physicians, and then you should align your training and to the Australian trained physician. You should fill the form according to the guidelines of Australian trained physicians. So and this way you can get so there is the cost is matter a lot, just for the assessment. It is 6,000 euro. So it will be around about 15 to 20 lakhs PKR, for the Pakistani doctors. So it's a lot, 2 million investment. And then when you are moving to Australia, there will be more, for your visa fees and all those. So it costs a lot. So guys, keep in touch. I will be talking to you later on as well.